Hey guys, hopefully this will help you a little bit with regarding kVp, mA, and what a grid is used for. On this image here, it's black and white. Changing the contrast of this image, we can kind of visualize how mA and kVp are affecting the image. So let's suppose that this image right here, black image, this is the image receptor with no image on it. Now, as we introduce mA again being the quantity of photons hitting the image receptor, you'll start to see some detail now hitting the image receptor, creating an image. So as mA increases, basically the IR is receiving information from the X-ray tube. Okay, so you'll notice that the image is forming, and so the more I increase the MA, more of the image shows up. Okay, what we're not seeing is quality of the image. So the quality of the image is controlled by kVp. So as we increase kVp, we can now see more image details coming through. And when we see this white stuff hitting the image, or we can attribute that to more photons hitting the image receptor. So if we do a high kVp and high MA, our image is just going to look white like this. The reason is because all of the photons are just passing through the body and hitting the image receptor. So you want to find a balance between the two where you have an appropriate amount of MA. Well, actually, you want to have the lowest amount of MA that you can get away with possible, right? Because we're increasing patient dose as MA is being introduced. And so we want to use the minimum amount of MA, but as we introduce kVp, it's going to give us more contrast to the image. So here I'm increasing the quote unquote kVp, and it's giving us more details. We can see the Hershey kisses at the bottom, and we can see the glass and things like that. Now, the problem with introducing kVp is you're also introducing more Compton interaction, which attributes to more scatter on the film. So even if we increase kVp, what we're seeing on the image here is not what's going to happen in reality, because we're also increasing scatter. So what we see on the IR, because introduction of more scatter, is we see a white film. So it'd be kind of like this, right? So this white layer that I've added on top resembles the scatter. So as kVp increases, the scatter also increases. We end up having an image that looks like this, although it's got details on it. All the details are kind of fogged out by this white cover, which is the fog or the scatter. So when you introduce a grid, it's going to reduce the amount of scatter. In other words, this layer right here will be absorbed by the grid, and so we're able to see a better image. The thing about grid is that it's only introduced when we're at thicker patients and thicker parts and things like that. Otherwise, we wouldn't use a grid at all. Hopefully that helps. Okay, bye.